Hello, welcome back. I'm Adam Rosen. I'm an orthopedic surgeon who specializes in total knee replacements, and I work here in Southern California. So today I want to talk to you about this little ball. I don't play golf anymore. I did play pretty competitively when I was younger. Actually, I probably haven't been out on the links in probably 20 years. But I do have a ton of patients that do play golf. And the patients that I see, this is one of the very common questions that I get asked is, how soon or how quickly can they get back to playing golf after a knee replacement? And it's a good question. We actually don't have a clear scientific answer. And even if you listen to some of my podcasts, if you haven't already found it, you can find it on any of the channels that host podcasts. Look for Your Knee, Your Health. There's a whole discussion there also about knees, that we don't have a particular knee implant that's made for knee replacements. That's another common question that people get asked. What kind of implant are you going to put in my knee because I do this or that activity? And for right now, we don't have specific implants for activities, but returning to activities is really based on your recovery. So when you talk to different surgeons, you might hear different answers as to a specific time or date from the surgery. But in reality, it really depends on how quickly you progress. Just know that when you bend and straighten, all knee replacements will bend and straighten. And when you pivot, all the knee replacements will allow some type of pivot so you can get back to hitting a ball. But you don't want to do it too soon. So what I typically recommend to a lot of my patients is, as quickly as you can get off of your cane and your walker, so now you're walking normally, go back out to the putting green and putt. Work on your short game. Unless you're one putting every single green, there is room for improvement. And it's sometimes nice. You've gone through rehab, you may have been at home for a while, just to get outside, get some sunlight, throw some balls down, practice hitting them, make sure that you can kind of get the stroke. It's a great reprieve from the grind of therapy and all the exercises that you're doing. But the next most important thing, and what I've learned over the years, is kind of letting people do a very slow phase in to returning to golf. Why? Well, many years ago, I didn't know, and most people don't know. They'll say, return when you feel ready to, or wait about 3 months. And what had happened was, I had a lot of patients that would go back to playing golf. And they would meet up with their crew and they would go out and they would play 18. And, by maybe the 9th hole or the 13th hole, they're starting to hurt. And now maybe they feel weird about saying, I'm done, and they play through. So now you were doing well, you played 18, and now you actually set yourself back 2 weeks because you go home, your knee's in pain, it's swollen, it's stiff, you can't walk, you can't do your therapy. So they just did too much too soon, but we weren't really sure when you were ready. So what I recommend to my patients is, depending on how they feel, and this may be usually 2 or 3 months. Some people, it may take them 4 or 5 months. I've had very, very, very few patients over many years that have said, at a month or 6 weeks, they were able to go back and hit a ball. But for most people, it's that 2 or 3 month mark. And what I'll say is, go out to a driving range, get a small bucket of balls, just bring a pitching wedge or a 9-iron, and just gently, pitch some balls, hit some balls, see how you do. Don't really wind and swing up, kind of more arms more than your whole body. And this way, if you hurt, if it feels sore, you can just turn to the person next to you and say, here, you can have my balls, and leave. Because this way you don't overdo it. You're not going out and playing a full round of golf. Now, if you do that, I always say wait about 2 days. There's this whole thing in orthopedics and in sports medicine that's called delayed onset muscle soreness. So you may not know for a day or two as to how your leg and your knee and your body's going to feel. So wait about 2 days. And then if you feel good, go back, get a medium bucket. And now what you may do is bring like a 5-wood. You might bring a 5-iron, 7-iron. Hit some balls, hit them a little bit harder. See again how you feel, and then leave. And then wait another 2 days or so. And then if you still feel good, then go back, get a large bucket of balls, bring your driver, really hit through all of your clubs. Really, really wind up, see how you're contacting the ball, and then wait 2 or 3 days. And if you can go through that sequence without having increased pain, increased swelling, increased problems, then go out and play 18. I do have some people, if they're lucky enough to, live on a course or live on play at an executive course, they might have that ability to say, well, I went out and I just played, 2 or 3 holes. And that's another option. That's another alternative. But if you don't have that as an option, and it's either play 18 and pay your fees or go to the driving range, this becomes a simple, slow progression to work into that. Now, the other thing I do recommend to a lot of people, though, is you may think about getting a coach. Maybe you've used a coach, which is great, and you can go back to the coach after your knee replacement. That's another alternative to the slow, kind of gradual return to playing. But for a lot of people, you may have made changes in your swing and in the dynamics of your stroke because of your knee pain or because of your knee arthritis or lack of motion. And now that that pain's gone or the motion's improved, you may find that your stroke is a little different. You might hook a couple, you might slice a couple, you might not know where you've changed as far as contacting the ball. So that's where it's really, really important to maybe look out to a professional at your club or at the local course that you can go and take a few sessions and find out what you're changing and what you're doing wrong or what you're doing differently. Now, if you can play, though, for a while, just realize that we can replace your knee. We can replace the surfaces of the inside of your knee, where your cartilage is. But you still have muscles, and you still have tendons, and you still have ligaments. So they may still get sore. And it's not uncommon if you go back and you're playing 18, let's say you're lucky enough to play, 18 3 or 4 days a week. In that first maybe 4 or 5 months from surgery, you can still be sore. Your back might be sore, your shoulder might be sore, but your knee can still be sore. It's not necessarily the implant. What you're feeling is the ligaments or the soft tissue. So for patients that don't have a contraindication, sometimes you can pre-medicate, take a few anti-inflammatories prior to playing. Or if you can't take anti-inflammatories, take a little bit of Tylenol before you play, and that might decrease any of the soreness or achiness that you may get as you're fully recovering from this surgery. But again, for a lot of people, one of the main reasons that they consider knee replacement is they have trouble playing the game. This little ball has caused so much joy in a lot of people and a lot of frustration. And if you're having trouble just walking, these are people that have gone from using the cart to, or walking, and now they're using the cart because of so much pain. They have trouble getting in and out of the sand trap because of their knee. That sometimes is the decision for them to make as to when to have a knee replacement. So they've decided, okay, now I'm going to have a knee replacement because I'm having trouble playing golf. But the next big question is, when can I get back to playing? I want to play. And this hopefully answers some of those questions. Obviously, talk to your surgeon because there may be specifics for you or your knee that may change the timeline. But I find for many of my patients, this becomes a good gradual phase back to playing. As soon as you get off the walker and the cane, get back on the putting green, work on your short game. When you're comfortable walking and doing everything that you kind of can during the day, you've progressed with your physical therapy, go out, bring your 9-iron, pitch some balls, see how you feel, and then slowly wean up to that medium bucket. Bigger irons, your 5-wood, and then go back later, hit a large bucket. Make sure you can hit a number of balls and make sure that you can really contact it well with your driver. And then if all of that works out, then go back to play 18. So I hope this helps. If you enjoy what you're hearing, please subscribe. You'll get information about updated videos as they come out in the near future. And again, if you haven't already seen it, you can search out my podcast, Your Knee, Your Health, where you hear a lot more of my insight on knees and knee replacements and just how to improve your general health. Thanks again for listening. I'm Adam Rosen, and in the meantime, stay safe.